Despite spending several nights in an intensive care unit, Hussein al-Sheikh is a lucky man. He believes that he's just dodged death. Hussein was admitted to a Saudi hospital after catching the same virus that killed his father just 3 days earlier.
Well, the first time they told me I have corona, the first things I thought about is I'm gonna die. Because I thought about my dad and I said it's going to be the same case and I'm gonna lose my life.
The coronavirus Hussein is talking about has so far killed 18 people. Most of the victims either live in or have visited the Middle East. Much like the deadly SARS virus that emerged in 2003, the coronavirus attacks the human respiratory system and quickly leads to kidney failure. If not treated properly, the patient can die within days. The biggest cluster has been found in Saudi Arabia. On a visit there, the World Health Organization said that while it fears the virus is able to spread from person to person, it's still too early to judge just how contagious it is.
This pattern of person-to-person transmission has remained limited to small clusters, and so far there is no evidence that this virus has the capacity to sustain generalized community transmission.
For now, the coronavirus is nowhere near as widespread as SARS was 10 years ago. That outbreak killed almost 800 people, but there is growing international concern. There are 2 confirmed cases in France, and like many of the other victims, one of those patients had traveled to the Middle East.
The first patient is in a stable but worrying situation. The situation for the second patient deteriorated, and that justified his transfer to intensive care. Professionals and doctors consider that there is no place for excessive worry, but once again we should be vigilant. Nothing is left to chance.
But unfortunately, because of the new and relatively unknown nature of the virus, some things will be left to chance as doctors and scientists figure out a way to ensure its containment. Jamal Elshayyal, Al Jazeera.